All right. So good morning, good morning, good morning. I'm so excited that everyone's here today. This is going to be a great presentation from Mary Talley about the work she does at the sanctuary at the Woodlands. She is the business development director, and she has a husband who's a firefighter, a beautiful redhead tween or teen, not tween.
Teen.
You don't want to mistake the tweens and the teens. They'll get mad at you. uh, two dogs, and she enjoys four-wheeling, fishing, camping, playing in the creek, saving turtles. Just Mother Nature, huh? She's your best friend. I love that. Um, and so her job is to help you by finding ways to help your loved one. So she's going to talk to us today about some of the resources at her agency, some of the programs, and I'm just really looking forward to this. I hope the information given today is of use to you all. Of course, I will send you a post survey after this so that you can give us your feedback. And this is actually our education stipend opportunity for the month of September. So if you complete this training and you fill out the survey, you may be eligible to receive a $25 stipend to go towards Respite in the future so that you can join us for other trainings like this. As always, if you have not yet done so, please put your email address in the chat so that I can get those surveys to you so that you can get that stipend. And without further ado, Miss Mary, I'll go ahead and turn it over to you.
Hello, everyone. Like Miss Jenny said, my name is Mary Talley. I'm the Business Development Director for the Sanctuary at the Woodlands. Our hospital is located in Coleman, Alabama. Okay. I talk to a lot of people every day, so I will occasionally look at my little notes here. So if you have any questions, please feel free to stop, interject at any time, or we can wait till the end, whatever is more convenient for you. So our hospital is inpatient Geriatric, but we have recently opened our adult wing, which is very positive. I've gotten a lot of feedback from doctors, case managers, everybody in the community saying that there is a great need. Obviously, you know, mental health is an issue across the world and underdiagnosed or not treated. Okay. So I'll tell you, thank you for your time. Thank you for being here. What our hospital does not do, and I'll go into that first. What we do not do is we do not strap people down, and we do not perform ECT, which is the shock therapy. We don't do that. Now, being a hospital, we do have restraints. All hospitals have restraints. Fortunately, we have not had to use them. We have a very skilled team. So with gentle technique, gentle redirection, mirroring, all those aspects that we use, all our resources, we haven't had to restrain anybody. So what we do is medication management. So let's just say you have someone that has depression, dementia, schizophrenia. They're very manic. They're not on their medication. They've taken too much of their medication. They haven't been prescribed any medication. Our team will either add medication, take medication away, titrate up, titrate down. A lot of times that is what is needed. People get lost in the, I don't want to take this anymore, or they have a parent that has dementia and it's very difficult for them to get their loved one to take their medicine, or home health agencies and hospice agencies go in and they can't get them to take their medication. That's where we step in. We have a team of psychiatrists, family practice physicians, family practice nurse practitioners, psychiatric nurse practitioners, and psychiatric PAs that go hand in hand with our social services department. They all come together as a multidisciplinary team and treat each patient individually. So that way, not everybody gets the same thing. Not everybody's treated the same. It's individualized for that person and their needs. Okay. Sleep hygiene is very important to all of us, every person. So some people get their days and nights mixed up. or some people have severe insomnia where they just can't sleep, can't shut off their brain at night, thinking about work all the time. That is also an issue that a lot of people face that can wreak havoc on your life. So if you know somebody that's having that, again, that is something we handle. Intake and output. Just like the younger generation, our elderly population, when you're not receiving enough intake, even you and I, you can become very dehydrated, but it affects the younger babies, the younger children, and the older people. It affects them drastically, as opposed to you and I can handle it a little more. Once you get dehydrated, especially in the elderly, they're very prone to urinary tract infections. A lot of people think urinary tract infection is too much medication, not cleaning properly, but it also can be from being severely dehydrated. That goes hand in hand. So our team monitors their intake and output. Okay. Also, because if you're not eating enough, you're losing weight, you're having failure to thrive issues, you're not thinking clearly because you're not having enough nourishment in your body. And it also, we won't go down that road, but it affects your heart. Okay. Crisis stabilization. So if you've ever seen someone that is very manic, talking till they're short of breath, cleaning, they won't stop, opening and shutting the door, they can't think clearly. There's so many issues and they need help right now. And the family doesn't know what to do with them. The home health agency, hospice agency, people coming in the home, caregivers, no one knows what to do or they cannot handle them anymore. That's when they come to the hospital for that stabilization. Again, they might have a urinary tract infection. Their medications may be doubled up accidentally, things of that nature. They may have not taken their medication in 3 days. That'll throw anybody for a loop. We can admit from the ER. A lot of people don't know that. We can admit directly from the ER, from home health, hospice, the hospital floor, from their home. We admit from the state of Alabama, in and out of state. Doesn't matter where. It's a very simple and easy process. I'm a huge advocate for caregivers going in the home health, and hospice. The thing about those agencies are everybody's there for short periods of time. So they don't have that 24-hour observation. And we get referrals from home health and hospice agencies, caregivers at home all the time. They're like, I don't know what to do anymore. So I'm going to go on the Jerry side for just a minute. Let's say you're home and you're watching your mom and dad, and they're getting up, wandering in the middle of the night, going to the street, falling down. You have to go to work. Or your dad is 80 years old and your mom is 80 years old and he cannot manage his wife anymore by himself. She's fighting him. I've had them threaten to kill their own spouse. One patient said he woke up and his wife had a box cutter to his neck, threatening to kill her. It wasn't her. She was going through a period of dementia right there. And that happens. They forget where they are, or it could be someone experiencing some PTSD. They hear a noise and they were in the military in their younger years. They're crawling on the floor and they think they're in a war zone. Things like that happen. Or they become very delusional and have hallucinations and they're hearing rats and bugs are crawling on their body and someone's trying to break in. My family's stealing my money. Everybody's against me. Nobody loves me. There's so many scenarios that I can tell you. And I always tell people this because I've heard everything, but the most frightening one was a lady said, Mary, don't you see all those dead babies with their heads cut off? That's the one I've never heard before. But in their mind and in their eyes, that is what they're seeing at that moment. And they need help. And on the younger side, so our adult wing, is mainly depression. We have a lot of younger generation with depression, mental health issues, mental health concerns that are not addressed. And they partake in drugs because they want it to stop. They want their brain to slow down. They want to shut off the world. They want it to go away. They want it to relax. It's very common now for people to be on CBD gummies, which, that's just common. We see it all the time, but they're self-medicating. So things can calm down, so they can relax, so they can feel better. And then a stepping stone becomes something greater than that, whether it's pills or harder recreational drugs. Then they get on a path where they want to stop, but they need help and they can't. Having said that, drugs are not a deterrent for our hospital, but we are very cautious. Geriatrics is very plain and simple, easy admission. The younger generation, if they're excessively violent, we're going to scrutinize before we allow an admission for the safety of that person and the safety of others. Drugs being on board does not deter an admission. We just need to be very careful for those around them and themselves. Like I said in the very beginning, mental health issues are undertreated, underdiagnosed. There's so many people that have mental health issues. And as myself, with my culture being Asian and Latino, you're always taught at a young age, and with other cultures as well. You don't have that. You don't talk about it. You're strong. You're going to push yourself through it. We're not going to discuss this. You don't have that. But it needs to be discussed and it needs to be addressed, because those are things that you cannot handle on your own. And I will get a little weepy here. I get weepy every time. So I apologize. I lost my mom 4 years ago. She had a stroke and she passed away. I didn't talk to anybody about it and held all my feelings in. But I went through depression because I was very close to my mother. Didn't talk about it. It's been 4 years. As a nurse, I know better. Finally sought help, and they didn't give me a crazy diagnosis. They didn't give me any medication. They said, Mary, you're grieving. It's very normal for you to grieve. You lost your mom. You're very close. But here I am telling everyone this, and I didn't do it for myself. So we know it happens. I'm now able to speak about it so others can get help. It's just an issue that we face, whether it's a situational depression or clinical depression. And people are like, I'm just tired. I'm just tired. I don't want to get out of bed. I don't know what's wrong with me. It could be depression. It could be something else. So we are here to help. And everything in our hospital is confidential. It is a very home-like environment. It is less sterile. It is less like you're being in a hospital. You feel very much at home there. It's very quiet and comforting. Again, the people have been trained. So it's not like you're going to Huntsville Hospital, and I love Huntsville Hospital, but you're going in the ER and you're waiting 8-10 hours. And a lot of people just leave. They don't want to be in the ER anymore. They're too tired. They don't want to talk about it. And they just leave without being seen. Our admission process is very simple. You call me and say, hey, Mary, or you email, fax the information directly to the hospital. A lot of people call me and say, hey, Mary, this is what I've got going on. I had one come from home, and, their mother was delusional. She thought she was a rocket scientist and she was wandering and she knew everything, so nobody could help her. Lots of things that were going on upstairs and nobody could explain it, and they were having a difficult time dealing with her. So basically, again, medication management helped that. Another one is a gentleman very recently thought he won $1 million and he was wanting to spend it. Just, I've got all this money, I'm rich, I can do all this stuff. He was in a manic phase, being bipolar, schizophrenic. He was trying to buy everything, spend all this money that he didn't have. But at that moment, he thought he had $1 million to spend any way he wanted. So I can give you more scenarios, but I want to go ahead and ask, do y'all have any questions? Is there an issue or something that you've come across with your loved ones or people that you see on a daily basis that you have a question about or feel like they may need treatment? Please ask any questions.
Mary, I have a question.
Okay.
So there are a lot of our caregivers are caring for either spouses or parents who have dementia or dementia related disease. How do we know the difference between just a common dementia symptom and something that would require more assistance, like where we'd have to call a professional?
Okay. You can call anytime. That is a great question. You can call anytime. So, as we all know, we cannot cure dementia. Okay. We can provide medications that can help. Hopefully, they're in the stage where you can hinder it, slow it down, or keep it stable. So, if you're going to a home and they're very grumpy, I don't want to do that. I don't want to do that. I don't want to do that. And you're like, I just don't know that I should call the hospital for this. If they become too difficult to manage, where you can't get them, where they want to change their clothes or take a bath or use the bathroom, or they're urinating more frequently, or they're starting to urinate in the corner where they never did that before, or they've picked a different corner to urinate in. Say they picked the corner in the dining room and now they're going in the kitchen. There's things going on that we don't know why. Are they in a different house? Did they move in their mind? Did someone assault them? So we had a patient that refused to go to the bathroom. He would urinate in the hall. Refused. During treatment, we found out he was assaulted as a younger man in a restroom. So he had a great fear of going in the bathroom. Now, once he'd get his medication in, became more stable and trusting, he would go to the bathroom, but then he'd revert back. So you've got to remember they are in different time frames sometimes, and they also experience sundowning. So that's why I say that's an awesome question, because when you're sundowning, it's during these hours that you see every day that they're being more difficult. Like they're the sweetest pie during the morning time, but 3 p.m. they start getting a little feisty. Well, they might need to add the medication during that time, just that time frame. And a lot of times that's that one time it's very simple. We're just going to start prescribing something at 2 o'clock to prevent those behaviors. Okay. Also, when they're acting any bit different than what they normally, so you go in their house every day, it's the same old, same old. There's a little change. And you initially think that's a one-time thing. But as it progresses, that's when it's either a urinary tract infection or they're starting to decline in their dementia. And like you said, how do you know? Well, not everyone's going to know right off. You just don't know, because dementia changes, so much. It is worth the phone call, and they will say, I really think they need to be seen. Or no, maybe the doctor needs to increase the medication, maybe by a milligram or whatever. Or maybe they need a PRN. Maybe they need something at night to help them sleep better. They're not sleeping well at night, so they're very grumpy during the day. So again, call anytime if it's especially a change that you're not used to. But if it's a change that you feel like, well, it's a one-time thing, that's okay. That's all right. But if it's something you can't handle, family can't handle, or the family is like, oh, we've never seen this before. It's better to know at the beginning than later on. Either way, it's fine. But usually the family knows, or someone that's seen them on a regular basis knows when there's the slightest change. And they're like, ooh, I don't want this to get out of control. They're just not themselves. Something's going on here. And it's usually the people in the home that see it and know it before anybody else. I hope that answered your question.
Yes, thank you. Does anyone else have any questions for Mary?
Do you only offer?
Well,
I'm sorry. Repeat that, please.
Me?
Yes, sir.
Oh, okay. Well, my situation, I take care of my wife. Okay. We've been, this coming December will be 52 years, marriage.
Congratulations.
Okay. Thank you. Okay, we've been, she was diagnosed with dementia back in 2015. Okay. We have been through all the stuff that you talked about. I've had, police 911 call on me and trying to jump out the car and all that.
I'm so sorry.
I even had her admitted to a hospital, and they strive medicine that calm that down. And so my point now, we're on hospice. I'm here in Monroe County, Frisco City. And I got nurses come in, once a week. They were coming twice a week. They come once a week. Back in April of this year, they took off all her medication. At one time, she had real high blood pressure and all that. And so she's not on any type of medication. And she's about like well as active, she probably like about a 18-month-old. She can't feed herself. She eats well. If I feed her, I sit and feed her each meal. She eats well. She have no trouble swallowing or nothing like that. And she hallucinate sometime, occasionally. Most times she sit, real quiet, and we get up, we walk. I assist as she walk, and so forth. And at one time, she wasn't sleeping with me anything. We had medication to help her sleep. Now, all I have to do is prepare her for bed, help her get into bed, and she'll lay with her eyes open a while, and eventually I go on to sleep, so I guess she do too. So I have no problem. So have you ever experienced anything like that?
Yes, sir. So first of all, I want to applaud you for your years of marriage. Congratulations and bless you.
Thanks.
We do admit patients from hospice because a lot of times, and I know you're familiar, but I'm just going to talk like people don't know. Okay. A lot of times people think when they're admitted to hospice, the end is very near. And that's not true in a lot of cases. Sometimes we admit on hospice, when they're admitted to hospice, they get discharged off of hospice. And hospice is designed to help you make a comfortable admission and they don't know exactly when the end is near, but they're thinking it might be sometime, okay? Again, people are admitted on hospice and discharged off hospice. We take patients on hospice. They do provide medication, but when we receive patients from hospice, it's because they're combative, agitated, they're no longer thriving, or no longer the admission that they're on, the reason for being on hospice, they can't see a reason to keep them on hospice anymore. So they will come to our hospital. Again, the medications will be managed. The doctor will say, well, if she's not sleeping well, then we might need to give her a little something for sleep, a little something for restlessness, things of that nature. We can make the transition back home. Our social services can help make the transition to a nursing home if that's what you or whoever chooses, an assisted living facility, or back home on hospice, or back home on home health. So, like I said, it's a common thing for us to admit from home health and hospice because of those issues. Families say, well, they're not really having any medication changes, or like you said, they don't have any medication, where they still need a little bit of medication. Are they just real agitated? Are they agitated all the time? They're not sleeping? Or is it a little bit too difficult for the loved one to manage? And, if she's still seeing things, some people do say, well, she's been seeing the same thing every day. She sees her kid, every day. I see my baby every day. Okay, but is it getting worse? Are they seeing other things? Are they scared? Are they constantly talking to someone that's not there? Are they fearful? Is someone hurting me? Is it becoming more and more difficult for you or the loved one or the caregivers to manage? And you're like, I really think she needs to be on more medication than what she's on. Or I just feel like she needs another checkup here. Something is not, the checks and balances aren't adding up. I need help. That's where we come in. And yes, we do see that. And I applaud you for going everything you've been through. That's very difficult. And all those years of marriage is a blessing. And I look forward to that myself. So George did, and I think you might need to ask me another question, because I think I gave you a lot of scenarios. So did that answer your question?
Well, some of yours were, I guess my connection was breaking up. I didn't get some of the first part of it. But like I say, now my personal belief that, if I had her somewhere else, she probably wouldn't make it, because, I don't believe they would, by seeing people in hospitals and homes. I know a lot of time when, it's lunchtime or whatever time to eat, they bring the food and sit it. And then 30 minutes later, they come back, and whether you ate or not, they're going to pick it up and go. And so, see, now I have to make sure she eats, so I feeds her and so forth. And I guess, it's no problem. It's just that I just have to do everything for her. It's all on me,
Okay. So
yeah.
You're exactly right. Sometimes in nursing homes, they don't have the staff that they need.
Right.
And I have seen that, not saying anything negative about any facility at all. But you're right. A lot of times they will deliver the meal. And if that person can't feed themselves, they're dependent on someone else to feed them. Or if they only eat one bite. And like you said, you kind of, Some patients need a little gentle, coaxing, hey, take another bite for me. Come on, let's eat just a little bit more, because they need to have that
Right.
nourishment in their body. And someone loving like you that's caring for their wife, they're going to have that extra loving touch there. And some facilities do not have that. And what happens is, if they're in a facility and they're not getting enough food, they start losing the weight and they're not getting the nourishment they need, and they start going into failure to thrive. And we're going to talk about more of you. The family gets very fatigued.
Mhm.
I'm not saying you are, but loved ones
Right.
get very
Right. I
fatigued,
understand. Right.
and they just cannot manage it anymore. And it becomes where they're sad because they feel guilty that they need help, or they're
Mhm.
just feeling overwhelmed. And that is a problem, because you need sleep yourself. You can't take care of someone else when you need sleep and you need to eat and you need to be able to run your errands and things like that. Where we come into play
Right.
is she eating enough? Does she need another medication to help her? And I know you said the video or the sound cut out a little bit, so if I'm being a little repetitive, I apologize. Sometimes they need medications to help if they're a little agitated or restless, just not sleeping well or not waking up. Some people want to sleep the entire day, and that causes the day night issues where their days and nights are mixed up. If they're sleeping too much at
Right.
night, waking up very late, then that causes that insomnia and the confusion. And again, the loved one that's caring for them or the caregivers are saying, well, they're sleeping all day long and not sleeping at all at night. And then that causes more issues, because your medication, you got to be taking them on a routine schedule. So if they're not up during the day, then caregivers or loved ones are like, well, I can't get them to take their medication during the day. So then 2 or 3 days go by and they're not getting their morning medication, whether it's blood pressure medication or insulin, things of that nature. That throws your organs and your body into a loop where it takes some time to go back to being stable where they need to be, because your 8 a.m. medications, you really need to take them at 8, 7, 8, 9 o'clock, and they don't want to wake up to take their medication. And then you're giving that medication at 4 o'clock. That's going to cause a lot of other problems.
Right.
So again, I just admire you so much for everything you do. When someone in that situation is admitted to our hospital, our social services team meets with you or whoever and says, okay, Mr. Joe Smith, we really feel like your wife would benefit from going to a nursing home. They don't do that without the permission of that person, but they say, I really think
Right.
it's in your best interest that this person go to a nursing home. If you disagree, they follow your reaction, your plan, and say, okay, if you really want them to go home, I think we should try home health or hospice again, or you need visiting angels or whatever company is near you. You need to have help. So we're going to help you with that process. We're going to have you pick out from these 3 agencies, who do you want to come into your home to help take care of your wife. And they talk with you about that. And again, that's part of that individualized plan where they say, you know what, I really feel like you don't need to be managing this on your own. So how about we do home health for X amount of weeks, or hospice for X amount of weeks, caregivers 2 or 3 times a week, whatever is easier for you, what you agree upon. You guys work on it together. Then they make that process happen.
Thank you.
You're welcome.
Mary, I think Crystal had a question perhaps. Crystal, did you have a question?
I did. I know a lot of the people here care for older adults. I was wondering if there were any kind of help services available for a caregiver of children with special needs.
Our hospital manages mental health issues for those that are 19 and up with the stabilization and all that. But as far as living a place for them to live, unfortunately, most of the younger generation that I have witnessed, they either go to a nursing home or a group home. Those are the places that I know that they are admitted to.
Thank you for that
You're
information.
welcome. And we have seen the younger generation for the mental health issues like depression and things of that nature, but also traumatic brain injuries. When someone has a traumatic brain injury or a congenital issue where at birth they had an aneurysm or something like that, a lot of people think, well, you can't help that. What happens is if they get a urinary tract infection, like anyone else, they might be a person that yells out, hey, hey, you, hey, you. Well, it becomes more prominent when their medications are off or they have an infection of any type. Let's just say they, got a small cut and it got infected. Well, this person that's younger, they start yelling out even more, or they start pounding the table, or they start, throwing their body around, trying to throw themselves out of a wheelchair, things of that nature. They're going to act, you're going to know that there's a change because they're going to act even more differently than they did before any of that happened. So that is where our younger patients come in, whether, like I said, it's a brain injury, something they were born with, anything like that, other than your 30-year-old that has schizophrenia or bipolar or depression, the TBIs, or even those with Down syndrome or Asperger's. Their behaviors become more prominent. They're just like defiant. They become so mean and agitated and don't want to do anything, not want to cooperate. I can think of one patient in particular. She would say, y'all just don't love me no more. Y'all just don't love me no more. Y'all just don't love me no more. They're picking on me. They're picking on me. Y'all just don't love me no more. And it was just a little glitch. Again, needed just a little bit of changes with their medication to get them back to where they were before. But to answer your question, Miss Crystal, usually the places that I have seen with younger generation is nursing home and group home. Unfortunately, those are the only two places that I know of.
All right. Does anybody else have any questions for Mary before we wrap up here?
And thank y'all. Those are very awesome questions. Thank you very much.
So Mary, I think it is important for us to know, just to be aware of what resources are available for mental health, because, even for people who are maybe not in a caregiving situation, or they don't have a loved one that they're taking care of, mental health is definitely something that our culture is focusing more energy on. We're becoming aware of how, all of our systems are connected, mental health, physical health, all that. And I think it's important for our caregivers, even if it's not, if you're not seeing any symptoms from your loved one that you're caring for, to also be mindful of these symptoms in yourself. You know, we did a suicide prevention education not long ago, about, you know, depression symptoms and things like that. And so I feel like even if you don't feel like your loved one could use Mary's services, also consider for yourself, are you where you need to be mental health wise? Are you taking care of yourself so that you can be well equipped? And you know, what you guys do is hard. You know, you see your loved ones struggling, you know, maybe having complications, and that weighs a lot on your soul, I'm sure. And so I just want to encourage everyone to be mindful of, you know, how are you feeling? How are you calibrating? And make sure you take those steps and reach out if you do need help.
I agree
And of
wholeheartedly.
course, I'm always available. Go ahead,
Every
sorry.
time
Go ahead.
every time I do a presentation, there's always someone that I see in the crowd that is nodding their head, nodding their head. They are either thinking, I'm going through this, I know someone that's going through this, or I have a friend of someone that's going through it. And it's always, I know of someone that needs this help. I really know someone that could benefit from help. Unfortunately, like you said, Jenny, and we see it every day. And like Miss Crystal said, she needed a break. We all push ourselves so much. George works 24/7. I mean, we all, every one of us, push ourselves day in and day out, day in and day out. And we have to get rest. We have to take care of our bodies, our mind, not just with food and nourishment, but mentally. And more people are opening up. People call me all the time, and it's so sad, the things that people have to go through before they want to. Some of them just don't want to admit it's going on. And I'll tell you one last quick story. I had a gentleman, he met with me personally. That man cried and cried and cried. He said, Mary, I've been with her since she was 14 years old. He could not put her in our hospital. He felt guilty. He wanted to handle it all, handle it all, handle it all. Finally, he had her admitted, transitioned to a nursing home, and he came one more time to visit me, and he said, she's doing better than she's ever done. I visit her every day, and she's forgetful, obviously, but they have their luncheon every day together. And it's kind of like that movie. I can't even remember the name of the movie, but it's just a sweet, sweet story. And their life is different now, but it's better. It's healthier for him and her.
And I also want to, you know, maybe underline the point too, that transition can be difficult and it can be scary. But a lot of our loved ones, you know, illnesses change, needs change, our ability to care give changes, and that's okay. There are resources available. It's not always going to be the same all the time. And it's okay to have those fears and it's okay to express those fears. But I feel like Mary has painted a very beautiful picture of their agency where, you know, they try to keep it, like you said, not as sterile as a hospital, try to make sure that the care that they're receiving is tailor-made to the person that's coming in. And so I hope that this information has maybe eased some fears if you've had them, if you've maybe been thinking about reaching out and getting additional resources, getting additional help. Mary has displayed wonderful compassion and kindness and gentleness here. And I'm sure that's just mirrors the staff there at her agency. And so if you need Mary, if you need some help with her, from her, and Mary, where can they contact you? What is some good email or website or something that they can contact you if they have questions or maybe want to get their loved one evaluated?
Okay. If y'all have a pen available.
I can type it in the chat as well.
Okay. I'm going to give you this information. And I'm gonna put on my glasses here because when you're my age, you have to wear these glasses. Okay. My work cell is 256-590-9846. That is my personal work cell. And my email is long, but it makes sense once you hear it. It's mtalley@woodlandpsychiatric.com. So you can always email me. Again, everything is confidential. You can email me, call me anytime. Or if you want to call the hospital, that number is 256-255-0820. And you can call me anytime. Anytime. Now, if I don't answer right away, obviously it's because I'm either doing one of these or meeting with a doctor, nurse practitioner, patient, whatever. But I always get back to you right away, and no question is judged or anything like that. So don't ever feel that way. Feel free to ask me any question. Obviously, I about broke down in front of y'all. I'm sorry for that, but it just shows that we all kind of go through some things in our life and we need help sometimes.
And Mary, I always encourage people, never apologize for your humanity.
Amen.
Mhm.
And I appreciate y'all so much again for your time. It means so much to me because awareness and just knowledge, education is key for everybody. I've heard so many different stories, and some of them are so very sad of what people have gone through in their younger years that have affected them and are part of the reason why they made some of the choices they made as younger adults. And some of them are just appearing when they become the geriatric age. And some of them it's just horrible abuse that they experienced. And it's just manifesting itself now. And sometimes they blurt it out. It's just all these years of pain and anguish that they've held in that it's just coming out. So
Yeah. And I think that's a good reminder too for all of us that it'll come out eventually, right? So it's good
it
to
does.
address these things now while you can make the most of what the time you have left. So thank you, Mary. Again, I'm gonna go ahead and wrap it up since we're creeping up on our 11 o'clock time here. Again, if you have not put your email address in the chat, please do so. This is an education stipend opportunity. So if you fill out the survey I give you, you may be eligible to receive $25 towards more respite care. And again, I am available for care chats. So if you want to talk, if you want to unburden yourself, if you want to vent, if you just want to have somebody on the other end to hear you cry, whatever you need to do, I'm available for that. So just send me an email. It's going to be jstang@ucphuntsville.org. Let me write that down here. And if you have any questions for me or for Mary, please don't hesitate to reach out. We're here to care for the caregivers.
And we can always
enjoy.
reconvene at another time again and do this again if y'all need to. Always available.
I'm always up for a part 2, especially when there's people who have registered who maybe couldn't make it for some reason. It's always good to have these repeat sessions. So thank you again, Mary, for your time and your energy and your resources and your compassion. And I hope everyone has a wonderful, beautiful, restful Tuesday.
Thank you. Y'all have a blessed day. Thank you so much.
Bye, everyone.
Bye.